So getting an eye checkup done is a little more complex than just seeing the doctor and the doctor quickly looking at you and telling you what problem you have. It's actually a multi-step procedure, which is often also time-consuming, which is why sometimes you see patients getting a little impatient, and that's because they don't really understand what all goes into checking your eye thoroughly. So when you walk into the eye center, once your basic details, including your age and all of these other things are taken into account, the next thing that is done is one of the technicians checks your vision, which helps us know how well you're seeing. The next thing that is often checked is the pressures in your eye, which gives us an indication of the possibility of glaucoma in your eye. Subsequently, an optometrist looks at you and they check the power that your eye has, which tells us what is the potential in your eye, how well can your eye actually see if we give you a glass prescription. Once all of this is done is when you actually go to an ophthalmologist. And that's when, with all of this information in hand, the ophthalmologist is actually able to identify pathologies, is able to tell you what problem you have and what can and should be done to treat them. In a lot of cases, we also put a drop, which is called as a dilating drop, which dilates the pupil of your eye, the small black part of your eye, so that we can see what is at the back, which is essentially our nerve layer, our retina. This is where all our nerve cells are located, and these are the ones that actually transfer the information that comes into your eye to your brain. And therefore, we need to dilate the eye, which again takes about 30 to 45 minutes to be able to examine that. Once all of this is done, the ophthalmologist is able to guide you further and give you the required treatment. In any of this examination, if there is an abnormality found, there are often certain tests that are needed. For example, if the ophthalmologist suspects that there is a weakness in your cornea, he might advise a scan to examine the cornea in detail, where we can measure the areas of weakness. We can see how much thickness your cornea has. If there is an abnormality in the retinal layer or the nerve of your eye, there might be certain scans or a visual field test which might be advised to identify where exactly in the nerve or the retina that pathology is, how significant is it, and how much is it impacting your vision. In case you have a pathology like a cataract, you might be advised surgery, for which again you might undergo a scan to identify what power should be the lens that is going to be implanted inside your eye when you undergo the surgery. So eye examination is complex. It is not as simple as many of us think. The ophthalmologist cannot just look at your eye with a torch and really identify all the possible problems that there might be. It involves a lot of equipment, it involves a lot of individuals who support your treating ophthalmologist, and it is quite a thorough process.